Hello, my name is Dennis Connors and I am your student nurse practitioner. And so what we're going to be doing today is we're going to be doing assessment of your ears and your eyes. Can you tell me your name and date of birth?
Hannah Connors, November 5th, 1998.
Perfect. And we'll check your wristband and make sure to confirm that. But what we're going to do is we are going to start with your eye assessment. And so we're going to do some things that we have done before with assessing your cranial nerves. But the first thing that I'm going to do is I'm going to come closer to you. And what I'm going to do is I'm going to get you to basically look at my pen. And we are going to get you to basically focus and so we can see, accommodate and everything. So I'm going to get you to focus your eyes on this pen. And I'm going to take it, I'm going to bring it closer to you, and I'm going to bring it farther. And I'm looking at your pupils to see if your pupils constrict and dilate to see if they can accommodate. It constricts as it gets closer. So look at the pen. I'm watching your pupils. There you go. They constrict. And you can see them dilate as it gets back. You can see it one more time. There we go. And so what I can go ahead and notice is your pupils are equal round. And so they're bilaterally round. There's no edema, no issues with that right there. I can look at your eyebrows right now and you've both got hair on both of them bilaterally. I'm gonna get you to raise them for me. I'm gonna get you to go down, close your eyes, open your eyes. Good job. All right, so what I'm gonna do is I'm gonna actually look at your conjunctiva, so your conjunctive eye. So I'm gonna pull down on both eyes. There you go, looking for kind of just a nice pink, no red or edema or anything like that. Now I'm going to look up here, I'm going to pull up on your upper eyelids, and I'm looking at your sclera, looking for a nice white. Yeah, there you go, nice and white, there you go. Pink up there. All right, and so now what I'm going to do is I'm going to look at your pupils and see if they are reacted to light. And so what I'm going to get you to do is I'm going to kind of cover your eyes like this a little bit, just to kind of have a little bit more darkness on your eyes. And I'm going to actually shine my light. And so I want you to look right at my nose, okay? Stare at my nose. And I'm going to put a light in your eye. All right, beautiful. It is round and it reacts. So it constricts when the light touches it. I'm going to do this for this side now, okay? And so it constricts as the light touches it, dilates back. I'm going to pull it away. Beautiful. And so it's equal round, right? And reacted to light and it accommodates as well. So you have Perla. The next thing that we are going to do is we're going to test your peripheral vision. And so what I'm actually going to do is I'm going to get you to cover your right eye while I cover my left eye, okay? And I'm going to bring my pen on the back side of your head, and you're going to tell me when you see it as I pull it back, okay? Just tell me when.
I see it.
All right, you see it. Beautiful. Now we're going to do it on this side too. Tell me when.
See it.
All right, now switch eyes, okay? We're gonna do the same thing. So it's behind your head. Just tell me when you see it.
See it.
All right, now I'm gonna do this side. Tell me when.
I see it.
All right, beautiful. And so we see that you do have peripheral vision, both sides, which is good. And now we're actually going to take a moment and I'm going to actually get my ophthalmoscope and we are going to test for your red reflex. And we're going to look for your optic disc. Okay. So what we're going to be looking for in this is we want to confirm that there is no obstruction. We should see a red, yellowish, kind of orange tint. If I can put this thing on. Let's do it this way. There we go, beautiful. And so I am going to shine a light in your eyes. It will be bright. And what we should see is we're going to look at your pupil. And so in your pupil, there should show literally a orangish, reddish, sometimes yellowish look, but it should be clear. I should be able to see the reflection of the light in your pupil. And so I should also be able to see that optic disc. So I'm going to do your left eye first, okay? So I'm going to start about right here. I'm going to look through. Get that reflex, there we go. And I'm gonna get a little bit closer to you. Beautiful. Okay, so we see that red reflex right there. You can see the optic disc in the back. And what that shows you can see a lot of the blood vessels in your eye, okay? Now we're gonna go to the other one. And we're gonna be doing the same thing, okay? So, all right, I can already see that red reflex. There we go. And we can see that optic disc. Beautiful. All right, so you've got a good red reflex. Often what you don't want to see is you don't want to see any black rings or black spots that can indicate is glaucoma or obstruction of some sort. And so, so with that, you can see a clear red circle through your pupil. Yeah, so that is our eye exam. Now what we're going to do is we're going to prepare, and we're actually going to do an ear exam, okay? And so that'll encompass a couple things. But the first thing that I actually would like to do is I would like to observe your ears. And so I want to look on the outer end of it to see the pinna, which is basically the outer kind of noise conducting system of it. I want to assess for drainage as well as make sure there's no bruising or red blood. Bruising can indicate some brain type of trauma. And then blood can actually, it can actually tell us that you have some type of infection or again, trauma to the head or the ears, okay? So I'm gonna look at this side first. I'm gonna move your hair from inside your ear. I'm gonna actually shine my light so I can see it pretty well. And I'm going to actually assess. So there's no drainage, there's no redness or soreness. Can you tell, is there any soreness to it?
Mm-mm.
There we go. So soreness can indicate brain trauma as well as just an ear infection. Any soreness when I do that?
No.
No bruising, no drainage. So let's look at the other side. And what I'm going to do is I'm actually going to feel it first. So any pain, soreness?
No.
Okay. So no redness to the ear, no drainage, no blood, no bruising. Beautiful. So now what I want to do is I want to do kind of a conduction test to see how well you can hear. And the first thing we're going to do is a Weber test. And so I'm going to take this tuning fork and I'm going to hit it on the top of your head. Not hit it on the top of your head, but I'm going to hit the tuning fork and I'm going to place it on the top of your head. And you're going to tell me whether or not you can hear it bilaterally or you hear it more on one side and whether or not you feel any of the vibrating of it, okay? So I'm going to hit it. All right. You feel the vibrating?
Mm-hmm.
All right. Can you hear it on both sides?
Yes.
Okay. Equally or more on one side or less on the other?
Equally.
Okay. So that's the Weber test, and what that's telling us is that you get equal air conduction on both sides, okay? Now, what we're going to do is we're going to do the Rhines test, and this is going to be testing your bone conduction as well as your air conduction. And so bone conduction should not last as long as the air conduction does, okay? And so bone conduction we will test by seeing how long you can feel it when we hit this tuning fork and place it on the bone. And then immediately once you stop hearing that, or feeling that, you're going to tell me, and then we're going to see how long it takes for you to stop hearing it on your ear, and that'll test your air conduction, okay? So I'm going to start on your right side, and then we'll switch to the other. So I'm actually going to hit this, and then I'm going to put this on your skull. Can you feel that? Tell me when you stop.
Stop. Stop.
Beautiful. All right, let's do this other side. And so we'll do the same. I'm going to pull your hair back for you. And we're going to place it again once on your bone. I'm going to tap it and then we'll put it on your bone. See if I can do it with my left hand. Okay. Feel that. Tell me when you stop feeling it.
Stop.
And tell me when you stop hearing it. And so what we see is that the air conduction definitely lasts a lot longer than the bone conduction, which is perfect. That's what you want to see. So those are within normal limits for both sides. Now what we're going to do is we're going to take the same light that we had, and we're going to use make it the auto scope function, and we are going to actually look at your ear, specifically looking, see if there's any obstruction, but also looking at the tympanoid membrane, which is also known as your eardrum, which should be kind of a gray, dullish color. Shouldn't have any bubbles in it, shouldn't have any injuries, or basically it shouldn't be in you shouldn't see straight through it. So we are going to look at that. I'm going to use my otoscope to do that. I'm going to put a little, basically a little thing over this to make sure that you don't get any ear infections or anything like that from someone else's stuff. And that way it's clean, okay? And so I'm going to take your ear, starting this side, and I'm going to stick this a little bit into your ear, and I'm going to pull up and back so that we can see. So there we go. And we're going to look. Beautiful, okay? So no earwax. We can see some hairs, and we can see that grayish color tympanoid membrane. All right, beautiful. No obstruction, no redness, no injury, anything like that. All right, there we go. All right, now I'm gonna take this little thing off. I'm gonna trade it. Now we're going to look into this left side. I'll pull your hair back just a little bit. I'm going to pull up and back, okay? And we're going to look one more in. There we go. So we can see that tympanoid membrane. No redness, no drainage. Beautiful. All right. So both ears are within normal limits. Don't see any type of injury or any infection. And so that is our ear assessment. And so what we've done today is we've done an eye assessment and an ear assessment, and everything seems to be within normal limits. And that is our exam for today. And so, yeah.